So we're going to be doing some cranial nerve testing. So we'll start with olfactory, and what we'll do with this one is you'll cover one nostril at a time and have the patient have like a familiar smell to them. You'll put it under the nostril, and then they will tell you when they smell something and then what that smell is. And then between the nostrils, you would switch the smells. That way they'll be different. So there's no like overlap and yeah. So can you close your eyes and
Yes.
cover one nostril? Okay. Let me know when you smell it, and then what is it? Or do you smell it?
Sure.
Yeah.
Yes.
All right, and then it would come to the other side, and you close your other nostril and say, "Can you smell this?"
Mm-hmm.
Okay, that's good. All right, so then we're going to go into vision, and there's a lot of vision testing. One of the big ones we can do first is an eye chart. So I would give the patient the smell and eye chart, and so for nearsightedness, I would give the patient the chart, have it about 3 feet away, and have them read the farthest down line that they can. To test farsightedness, I would have the chart about 20 feet away, and they would read the chart from there, the farthest down line that they can for that. I can also do visual field testing, so that would be where I'd move my finger, and they would let me know when they could or when they couldn't see my finger anymore. So if we're starting here, I'm going to come out to the side. Let me know when you can't see my finger anymore. Right there. Okay. And coming from the side, let me know when you can see my finger. Right there. Okay. And so here we're just looking to see if there's any field cut, any area that they can't see my finger. So I'd come to the other side. I would say, let me know when you can't see my finger anymore. Right there. Okay. And then let me know when you can see my finger. Right there. Okay. And then you can also do this from top down. So if I'm right here, I'm going to move my finger up. Let me know when you cannot see my finger anymore. Right there. Okay. Then coming down, let me know when you can see my finger. Right there. All right. Now we're going to go down. Let me know when you can't see my finger anymore. Right there. All right. And then coming up, let me know when you can see my finger. Right there. Okay. So all of that seems to be good. Now we can do some quadrant testing. So if you can stand up for me and face me. What you'll do, I'm going to cover my right eye. Can you cover your left eye?
Yes.
And I'm going to place my finger in all 4 corners. I just want you to let me know what numbers I'm holding up.
Okay.
Okay. 1, 2, 1, 2. Okay. And let's do the other side. Same thing. What number am I holding up? 1, 2, 1, 4. All right. Good. And so I'm just covering my eye with her just so I know, like I'm not moving my finger outside of my own vision and making it unfair for her. The last thing I can do, you can take a seat. The last thing for optic I can do is also going to test oculomotor for 3 at the same time. So I would just shine the light into one of her eyes. For the eye that I'm shining the light in, I'm looking for the pupillary reflex. So I'm just looking to see the pupil constrict. And at the same time, I can look for the other side for oculomotor and just see if the other eye constricts as well. All right, so just look straight forward. I'm just going to shine the light in here. Good, and then I just come to the other side, and I would just shine the light in. And I would just look for both eyes constricting. So more for oculomotor that we can do is just do the range of motion for it. So I would do the H pattern to get all the quadrants, and I would also just look for the smoothness of the eye as I do that. All right, so looking straight ahead, just follow my finger, okay? Keep your head still. Good. And then once we get to here, I can go into cranial nerve 4. So that one's going into the nose to look at that adduction of the eyes. So what I would say is, let me know when my finger becomes 2 or gets blurry. Right there. Okay. Good. And that was pretty close to her nose, so that's normal. If it's greater than like 5 inches from the nose, then that means it's not normal. Yeah. So that was 1, 2, 3, 4, and then 6 we did when we went out to the side for abduction. So now for 5, for trigeminal, for the sensory part, I can just use a cotton ball and I would just touch around the face to see if she has sensation. So can you close your eyes for me? Let me know when you feel this cotton ball on your face. Yes. 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 Good. Alright, and I'm just testing there where the trigeminal nerve runs through her face. For the motor part, I can test the muscles of mastication. So I would touch over here at her temples, for the temporal muscle, and just feel that contraction. So right here, can you clench your jaw for me? Good, relax. And then can you move your jaw side to side? Perfect. Okay. So going into cranial nerve 7 for facial, this one we can do some facial expressions. So can you smile big for me? Blow out your cheeks. Look angry. Sorry. Okay, look surprised. There we go, I'll take it. And then what we can also do is check for sensation. So that's the anterior 2/3 of the tongue. We could put something sweet on her tongue and just see if she can feel that, like a peppermint. So then going into cranial nerve 8, there's 2 parts. There's the vestibular part and the cochlear part. So for the cochlear part, I would come behind her, and we would just be testing her hearing. Do you hear this sound here? Yes. Okay. So I'm going to do some tests with that kind of sound. Let me know if you hear that sound and what ear that comes from. Okay. Okay. Can you close your eyes for me? Mm-hmm. Right ear. Left ear. Right ear. Both ears. Good. Okay. So for the vestibular part, what we're going to do is VOR. So I'm just going to have Mallory hold her arm out, look at her thumb, and shake her head back and forth while keeping her eyes on the thumb. And just looking at her eye movement here. So can you hold your arm out in front of you, look at your thumb, and shake your head back and forth as fast as you can. Keep going. That's good, you can relax. If the patient was unable to lift their arm up and they couldn't do that, I could always point to an object across the room and have them look at it that way. So now we're going into cranial nerve 9. This one you could do sensation with the back of the tongue, the posterior 1/3, and that can just be like any kind of sour tasting food to see if they could taste that. The other thing that I can do for motor is to have the patient say ah, and I would shine a light into their mouth and look for deviation of the uvula and elevation of the top palate. So can you open your mouth and say ah? Ah. Good. Alright. And kind of the same thing with cranial nerve 10. I would have the patient kind of repeat that. We would do ah again, but then we would look high and low of that pitch and still look for the uvula and the soft palate. So can you say ah again? Ah. Can you go higher? Ah. What about ah? Good. Okay. So now we have cranial nerve 11. What we would do for this one is we're just looking at elevating the shoulders and then the SCM muscle. So can you shrug your shoulders up? Good, and back down. Can you look up and turn your head to the left side? Mm-hmm. Good, now come back to center. Can you turn your head and look up towards your right side? Good, relax. And then for the last one, for cranial nerve 12, we're just going to look at the tongue for deviation, just to see when she sticks her tongue out if it's going to go from side to side. So can you stick your tongue straight out? Good, everything looks good.